Health experts are calling for more action to deal with rising cases of depression and other mental health problems among those living with HIV and AIDS. This follows a study by Medical Research Council and Uganda Virus Research Institute that showed that 1 in every 3 people living with HIV and AIDS suffers some form of mental health illness. For 10 years, Medical Research Council and Uganda Virus Research Institute have been carrying out a study on the state of mental health in the country. Professor Nachmuli Mpuga supervised the study titled Mental Health Prize: How to Recover from Depression Happens, targeting 1,000 youths living with HIV and AIDS in Hoima. While recovery is not a one-time event, the study found out that seeking emotional support early can shape the entire healing process.
During therapy, we saw there were only 3 significant mediators or 3 significant changes that occurred that were responsible for the reduction of depression at the end of therapy.
The professor also said that there was a dramatic decline in depression, which highlights the impact and power of the interventions.
The total GSP effects that are explained by the post-therapy changes. Number 1, seeking help from others. Number 2, building self-esteem, reduction in stigma.
The study calls on those living with the ailment to accept their situation and seek help. It also shows that early changes, especially in emotional expression and the seeking of emotional support, appear to trigger healing and continue to influence recovery even after therapy ends.
Begin with, before group support psychotherapy, it was really very difficult to engage young people.
The researcher reveals that young people need a place to belong, a family they can run to when overwhelmed with challenges, stuck, and with emotional breakdown, and regularly meeting as a group because they felt safe and motivated to make important decisions as they listened to their peers. Referencing the study, Ms. Barbara Kemjisha, a youth living with HIV and one of the participants, opened up about her experience.
I'm a woman living with HIV, and to be honest, when I tested positive, I had to live on the streets of Kampala. I was pregnant. So that was a very difficult time for me. And I had a lot of mental breakdowns, but with a lot of support, I met people, amazing people, who helped me to rebuild my courage, my confidence,